call, I will be discussing the impact of incentives on healthcare workers' job satisfaction. Healthcare job satisfaction. The impact of incentives on the healthcare sector has been widely studied. In many sectors, incentives are used to motivate workers to perform in a certain manner. Job satisfaction is essential among healthcare workers like doctors, nurses, physician assistants, administrative staff because it affects the quality and the efficiency of healthcare services. Healthcare work environment is said to be highly stressful due to long irregular hours and emotional stress. These are a few challenges that make job satisfaction for healthcare workers a major challenge. This study aims to explore how monetary and non-monetary incentives will influence job satisfaction among healthcare workers in public and private sectors. Incentives across sectors. This slide will show a comparison of incentives in two different healthcare sectors, public versus private. A comparison of the average satisfaction rating for different categories such as job security, salary, and recognition between public and private healthcare employees. Private versus public healthcare sectors. Private sectors typically use monetary incentives to motivate their staff. And these things include direct cash payments like raises and bonuses that in time will provide short-term productivity but may not always lead to a long-term motivation and may cause stress if overused. Whereas the public sector, they more so value non-monetary incentives like job security, recognition, and benefits are also important motivators that public healthcare organizations rely on to encourage employees and to avoid retention. Recent studies have shown a concerning trend in the healthcare industry. Healthcare workers are reported to have the highest work stress compared to other professions. Research by Green and Brown showed that non-monetary incentives such as job security, professional growth opportunities, and recognitions play a critical role in job satisfaction and organizational commitment. Whereas Danish and Usman found that when incentives and recognitions are properly implemented, it motivated employees and led to a higher job performance. Various comparative studies have explored the effectiveness of incentives across different sectors and countries. Here you see that there was a comparison, and the countries included were United States, Japan, India, and the United Kingdoms. And this comparative study was used because it wanted to focus on cultural and organizational differences in the effectiveness of incentives. Hasfed did a study in regards to U.S. and Japan. In the study, he found that American employees responded more positively to monetary incentives like bonuses and financial incentives, while Japanese workers value non-monetary incentives such as job security and team recognition. These were based on cultural values, with individualistic cultural favoring personal rewards and collective cultural focusing more on group harmony and stability. Patel and Kumar studies work motivations through incentive programs in both the public and the private healthcare sectors in India and in the United Kingdoms. The authors found that India healthcare workers in public sectors value job security and pension benefits more than the healthcare workers in the private hospitals, who value salary and career development. In the United Kingdom's public healthcare workers reported a higher concern towards their work-life balance than workers in the private sector who were motivated by money. Theoretical framework. This study will explore two theories: Hertzberg two-factory theory and self-determination theory. These theories will provide a framework for understanding how incentives influence employees' performances and job satisfaction. The first theory, Hertzberg two-factory theory, will discuss why incentives influence employees' loyalty, which in turn leads to a higher employee performance and job satisfaction. Hertzberg found that satisfaction and dissatisfaction were separate and did not automatically decrease as it was previously thought. He went on to describe factors that caused job satisfaction and divided them into two different parts. One was motivators that can increase satisfaction, like recognition, and hygiene factors that prevented dissatisfaction, like salary. Hertzberg two-factory theory is used to this day to help companies and sectors improve employees' retention and engagement in many companies by focusing on these motivators that provide internal awards. Self-determination theory, therefore, provides a better understanding of how different types of motivation affects employees in various sectors. Self-determination theory concentrates on two types of motivation. This is intrinsic and extrinsic, and how it affects the human behavior. Intrinsic motivation focuses on what is within a person and relates to satisfying the basic psychological needs, like social and family connections, our feelings of self-worth, and having control, versus the extrinsic motivators, which is influenced by external factors, such as job security and self-worth. These different perspectives can affect job satisfaction and productivity of both sectors. The hypothesis in this study aims to explore that monetary incentives like bonuses in public healthcare sectors will have a positive influence on healthcare workers' job satisfaction, whereas non-monetary incentives like job security and public healthcare sectors will also have a positive influence on healthcare workers' job satisfaction. The methods section. Here we see that we have samples and participants. The population here will consist of healthcare workers from diverse backgrounds. These diverse backgrounds will include Blacks, African Americans, Caucasians, Asians, all Americans, right? The sectors that will be covered will be the public sectors and private sectors. And these will include nurses, doctors, physician assistants, radiologists, and all administrative staff, right? The sample size for this study will consist of 60 participants, right? And it will be 30 from each sector, 30 from the private, 30 from public sector. And I will also include a 30-30 male to female ratio, right? So that will be used as well. Here we see that the method section here, data collection methods will be quantitative data, which will consist of surveys with Likert scale questions on job satisfaction and perceptions. And the right, you see that I've included something similar in regards to how the survey will look. The next one in the data collection method will be qualitative data, and this will be a semi-structured interview to explore personal experiences with monetary and non-monetary rewards for the participants, right? Variable studies. In this study, we will have to identify the independent variable, which will be the types of incentives, and that will be both monetary and non-monetary. And then we will have the dependent variable, which will consist of job satisfaction, employee retention, and work-life balances. Materials. This study will consist of a recruit script, a consent form, and a survey. A social media script was used and created to promote on social media platforms like Reddit, Instagram, and LinkedIn. All surveys will be completed through the Google survey. We can see that the survey questionnaire is structured questions that will assess job satisfaction, motivation, and perception of monetary versus non-monetary incentives, and the Likert scale responses for qualitative analysis, right? Then this survey will also consist of 25 questions that will measure healthcare workers' perception in regards to, again, non-monetary and monetary incentives on job satisfaction. The survey would consist of 5 questions from organizational commitment questionnaire, 10 questions from the healthcare productivity scale, as well as 10 questions from the Minnesota satisfaction question. The 5-point Likert scale, as stated before, will be used to evaluate the survey results, and it will be graded 1 that equals strongly disagree to 5 that means strongly agree, and the survey will take approximately 15 to 20 minutes, and the IBM SPSS will process these results. The procedure. Initially, participants will be recruited via email and announcements through relevant forums such as the scripts. Recruitment materials will include purpose of the study, participants' requirements, and the incentives, if any, are the benefits of participating in this study. A contact point will be provided for further information for all participants, and then the consent process will be next. This will include interested participants who will receive a detailed consent form, right? And in the consent form, it will explain the study goals, it will explain procedures involved, it will explain the potential risk, confidentiality, and data protection measures. And then the participants will be asked to sign the consent form to confirm that they voluntarily agree to participate in the study, as well as to say that they understand the terms of the study. Next, they will be provided with orientations, where the participants will attend an orientation session, and in this session, it will cover the study overview and the significance of it and how the data will be used. The participants can, at that time, ask any questions or raise any concerns during the session, right? And then we will have the initial survey that will take place. They will complete the survey, and this will be done by gathering just a baseline data from the individuals, and then this can help provide a more relevant insight to the study's objectives, right? Then the debrief session will be next, and after that will be conducted after the data is collected to explain the findings and to get a broader implication, right? After this, the participants will be reassured about the data confidentiality and usage involved, and then the participants can ask any additional questions, and they will receive feedback on the study process. The plan of analysis, as you can see this chart here, the plan of analysis shows the data collection, then it goes to the collect survey responses from the 60 healthcare workers from both the public and the private sector. Then we can see next is the self-administrated questionnaire that's consisted of 25 closed ended questions, as we spoke of before. This will include the 5 questions for the organizational commitment questionnaire, 10 questions for the healthcare productivity scale, and the 10 questions for the Minnesota satisfaction scale. And you can see, as we stated before, that the responses will be using a 5-point Likert scale, and it will be graded from 1 strongly disagree to 5 strongly agree. As we stated before, the demographics will be summarized. Age, gender, income level, and work sector will be described in this portion. Then we will use frequency distribution and percentages to analyze the response on how healthcare workers rate job satisfaction for different incentives types. For example, we could compare the public versus private sector ratings, right? And this will be monetary incentives like bonuses versus non-monetary incentives like job security. And in this study, we will be taking individuals from the work sector of public and private healthcare sectors. The age for individuals in this study will be from 21 to 59. The gender will be male and female. The income level will be from 59,000 to 75,000. And here we have the inferential analysis and the qualitative analysis, right? In the inferential analysis, it will consist of an independent sample t-test where it will compare the differences between the public and the private healthcare workers and the perception of incentive types, right? Then there will be a correlation test that will examine relationships between specific incentives. That will be the monetary rewards, security, and recognition in the overall job satisfaction. Then we will use a regression analysis that will predict the extent to which monetary and non-monetary incentives will influence the productivity and job satisfaction. When it comes to the qualitative analysis, right, we will analyze written surveys responses to identify the common things on job satisfaction and incentives, right, and examine participants' feedbacks to uncover patterns in the beliefs about monetary and non-monetary motivators. In this slide, you can see the visual display, the relationship among different job satisfaction facets using the Likert scale, right? The Likert scale scores for categories like career advancement and salaries, and this will provide a comprehensive view of their interdependencies. That will be ending my study for this class. Hope you enjoyed. Thank you.